Hi, my name is Dr. Mary Weidner, and thank you all for being here today to learn more about stuttering and a newly developed program aimed to improve young children's attitudes towards children who stutter. I would like to thank Dr. Katarzyna Wałżerska and all of her students and colleagues that have made the training and implementation of this program possible in Poland. The purpose of this training is to provide current information about stuttering, to provide an update on research related to stuttering attitudes, and to provide information about the Attitude Change and Tolerance Program, which is aimed to improve young children's stuttering attitudes. Let's begin by defining stuttering, discussing some basic facts about stuttering, as well as our current understanding of stuttering causes. Stuttering is a complicated disorder. According to the American Speech, Language, and Hearing Association, stuttering is a disruption in the forward flow of speech that can take many forms and be accompanied by physical tension or tightness when speaking, secondary behaviors such as eye blinking, head nodding, movement of the hands or feet when speaking, negative emotions and reactions, as well as the avoidance of certain sounds, words, or speaking situations. Stuttering most often begins in early childhood with an average age of 33 months. Approximately 1% of the adult population stutters, with a ratio of about 4 males to every 1 female. The cause of stuttering is multifactorial in nature, and while we cannot say with 100% accuracy the cause of stuttering for every individual who stutters, we do know that neurophysiology as well as genetics play a very strong role in the cause of stuttering. A great deal of research continues to be done in this area. At this time, we know that stuttering is not a behavior that is learned. It is not a behavior that is imitated, and it is not caused by a psychological disorder such as increased anxiety, nervousness, or shyness. For children under 6 years of age, the primary goal is to eliminate or greatly reduce stuttering. It is during one's early development in which we have the greatest likelihood for children to recover from stuttering. Because of this, a wait and see approach is not recommended. In fact, it is recommended that children receive early intervention for their stuttering to have the greatest likelihood of recovery. After age 6, the likelihood for complete recovery of stuttering decreases. At that time, stuttering therapy focuses greatly on management of stuttering. This might include stuttering less, stuttering with less tension, and improving one's communication attitudes. All therapy for people who stutter, regardless of how old they are, should target the observable characteristics of stuttering, which includes the repetitions, the prolongations, the blocks, and the physical tension, as well as the thoughts and feelings associated with stuttering. This gives the most holistic therapy approach for our children, teenagers, and adults who stutter. Now let's discuss current research about stuttering attitudes among the general public. When we talk about stuttering attitudes, we're referring to what people know or believe to be true about stuttering and people who stutter, how people feel about stuttering and people who stutter, as well as how people are outwardly reacting towards people who stutter, especially things that might be helpful or unhelpful to do when interacting with a person who stutters. We know that negative stuttering attitudes exist around the world in all cultures and have been measured as early as preschool. We also know that negative attitudes persist throughout adulthood. This is very important because children who stutter are at high risk for teasing and bullying, for social exclusion, as well as academic difficulties. Recent research has used the English or a translated version of the Public Opinion Survey on Human Attributes Stuttering for Children to measure young children's stuttering attitudes. The survey is comprised of a series of yes/no questions which are based on a video stimulus of stuttering characters. The results are compiled into a self-reactions or beliefs subscore, which are then averaged into an overall stuttering score. The results give an indication of what children know about stuttering, think about children who stutter, as well as how they would respond to a person who stutters. The scores are mapped on a continuum of -100 being the most negative or uninformed attitudes to +100 or being the most positive or informed attitudes. To date, the PASHA has been carried out in the United States, Turkey, Poland, and Bosnia and Herzegovina. A summary of these preliminary studies are quite interesting. Results have shown that stuttering attitudes actually improve between the preschool years and the school age years, meaning that preschool children have the most negative or uninformed stuttering attitudes. Findings suggest that children who don't stutter believe that children who stutter are fun to play with. Children who don't stutter are empathetic towards children who stutter. But they also believe that children who stutter are nervous and shy. While they would be patient and not laugh, children who don't stutter would also say, slow down, or finish the words of a child who stutters. We know that these are not helpful or desired supports. The results of these studies indicate that we must teach children about stuttering and how to respond appropriately to children who stutter. They also tell us that this intervention needs to be done at a young age in order to prevent negative social consequences for children who stutter. It's our goal that intervention, or teaching children about stuttering and how to respond to a child who stutters, can promote a very positive communication environment for children who stutter. I would now like to share information on a newly developed program aimed to improve young children's stuttering attitudes. The program is called the InterACT program, which stands for Attitude, Change, and Tolerance. The primary goals of the program are to teach children about stuttering and how to appropriately interact with peers who stutter. In addition, it focuses on improving acceptance of various human differences. The program is comprised of 2 puppetry-based educational videos, a theme song, small group discussion, as well as an activity book which the children can take home. Throughout the program, children learn basic facts about stuttering, as well as helpful supports when talking with people who stutter in the broader context of human differences. This is a still shot from one of the videos, and as you can see, the characters represent various human differences. After watching the educational videos, the children then engage with a discussion with the teacher or the clinician or who's ever moderating the intervention. On the back of these placards is a script on what the facilitator asks the children. For example, in this scene, Ben and Rosie learned about ways people can be different. What's one way Rosie is different? What's one way Ben is different? Does Ben stutter because he is nervous or shy? Does he stutter because he's sick? Does Ben stutter because he learned to talk that way? Does Ben stutter because he was born that way? That's right, Ben stutters because he was born that way. Ben can do all the same things other children can do. Stuttering is just what makes him different. Another example of one of the discussion cards is when Ben interacts with Hannah. Their first interaction is very bad. Hannah laughs at Ben stuttering. She walks away when he is talking, and she finishes his words and sentences when he is talking. So after those videos, we discuss with the children what Hannah did that was unhelpful and what Hannah did that was helpful. Making sure the children can explain what they saw and process the information is very key to their learning. To date, the InterACT program has been conducted in the United States as well as Poland. Using the Public Opinion Survey on Human Attributes, we measured children's stuttering attitudes before and after the InterACT program. This radial graph shows children's stuttering attitudes with the solid line representing before the program and the dotted line representing after the program. On the left-hand side of the screen is children in the United States, and on the right-hand side of the screen is children in Poland. As you can see in both of these studies, the attitudes are much improved following the study, with the dotted lines more on the periphery of the radial graph. This indicates that the InterACT program has been shown to be significantly effective in improving children's beliefs and self-reactions toward stuttering and children who stutter. So this tells us that there is sufficient evidence to use this program as an instructional and prevention tool. Ultimately, we hope that this intervention will improve the communication environment of children who stutter and foster more tolerant and accepting environments for our children. Thank you so much for your time learning about stuttering and the InterACT program and your consideration for using the InterACT program in your professional practice.